Thanks a lot for joining in this important session. I would like all the speakers to go on mute. Yeah, thanks a lot. We'll have a back. Yeah, so since morning, this is a day two of Healthcare Transformation Summit, second edition. From the day one had different, sessions where we had something on EHR, we had something on a lot of diagnostics, and we are here to talk about that. So the panel will be on leveraging innovations in diagnostics. Before moving into the panel, we have a industry presentation by Dr. Sharbanu Ghosh Dastidar, Customer Relations KOL J Mitra and Co Private Limited. I would like to call upon Mr. Dr. Sharbanu for his presentation, and soon after the industry presentation, we'll have the panel discussion. Over to you, Dr. Sharbanu.
Thank you, Ms. Pratibha, for that wonderful introduction, and thank you, Elets, also for gathering all of us in this brilliant platform. I think this is a wonderful stage, and we have to get used to the new normal now. Like Dr. Dinesh, and you are already working from home, so I think that becomes the new normal now. And I welcome all the speakers on board also to have a wonderful panel discussion hereafter. So bringing forward, I will just now share the screen for all of you. So actually I will be discussing about the corona pandemic, the digital and the innovation in diagnostics, and what we have done in our company in J Mitra. So if we look into the diagnostic protocol, so the very first part where the challenge actually starts is the asymptomatic infection. Now, obviously, due to the camouflaging of the symptoms, what we have in the respiratory systems, it's very difficult for any clinician or the physician at the upper end to actually diagnose between a normal respiratory infection and COVID to actually identify at the very beginning. Then it definitely aggravates to mild infection, where you will have sore throat and runny nose and different other symptoms to aggravate. Now, if that mild infection is also getting neglected, then obviously you will have to feature it out to the moderate infection, which will be much more higher side of it, where you will have clinical signs of pneumonia. And I would say to a certain extent, pneumonia and ILI will definitely mimic with each other over here with persistent fever. And definitely over here, the chest CT scan will definitely be one of the tests where you have to pinpoint whether you are actually diverging towards SARS or per se COVID or anything like that. Now, apart from that, if at all, if it is not screened properly, then obviously you will have the severe and the critical down the line, where you will obviously have the loss of smell, and you will have pulmonary disorders, and you will have respiratory symptoms which will be aggravated along with diarrhea. So these are the clinical protocols which are definitely mandated by WHO also. But now the problem is here that with respect to all the COVID hospitals which are there in the system, obviously it will be very difficult, I can understand, with the workflow and obviously with the patients which are coming from different stratas to actually pinpoint at the very early level. So obviously we have to be vigilant to actually pinpoint which are the patients over there and how they have to be associated to the COVID treatment plan. Now moving forward, if we look into the COVID testing kits, okay, we do have ELISA platform, we do have CLIA, the antigen rapid, RT-PCR and TrueNat. Now all the way from ELISA, CLIA, rapid, you can see that it has trickled down to the molecular level. Now, probably COVID has been a very learning experience for all of us, that for the very first time, that molecular test had taken the center stage right from the beginning of the pandemic. I can understand that there was a learning curve for everyone and there was paucity of resources also. But nevertheless, during the course of the lockdown and the infection have progressed, ELISA and CLIA and rapid test have also come into the foray. Now, the major USP with ELISA, what we have developed is that the IgA is obviously a potent marker as far as respiratory infection is concerned. So it can detect all the immunoglobulins. The other part is that ELISA test absolutely has no cross-reactivity with any other coronavirus infections. So it gives an added advantage and adds to higher sensitivity and specificity. And the best part of it is that it can be used as a surveillance tool, which has been mandated also by ICMR now. So it can be used for contact tracing and community seroprevalence. So the very first product which Gemitra actually brought in board was the IgM, IgG, and IgA. We call it a total antibody microELISA. Now, this is based on double antigen sandwich principle, which has been evaluated by ICMR. We do have a very good sensitivity at 94.04 and a specificity of 100%. Now, to make assure of it, now ELISA is definitely not a new technique. But the point over here is that this is very much the very first platform to actually screen. Obviously, you can screen with different other platforms, but this is definitely not a diagnostic tool. When you are talking about hotspots, like in the cases when we had the lockdown coming into effect, we were talking about containment zones, we were talking about community screening. So this is the very first particular kit which has been very successful, and it has been able to isolate people from the main population that, okay, you are the people who are suspected. So it gives a very niche kind of test results, like where you can actually preliminary screen out the people who are actually getting infected with the virus. The second obviously was the coverage. Now obviously, as the name implies, coverage means a protective cover. Obviously, this is relevant for people who are actually having the infection and who are on the recovery phase of it. Now definitely it is targeting only the IgG molecule, and this is basically a transfer of technology product from ICMR, and it has been evaluated at NIV Pune with a sensitivity of 96.33 and 100% specificity. The best part of IGG coverage is that it actually helped in the serosurveillance, obviously, at the hospital level when the nodal centers were created, when the hospitals were there designated for COVID patients. So during the palliative care and also with respect to the ongoing treatment plan, Coverage ELISA was very helpful to understand whether a particular patient would actually require a plasma therapy or not. I'm not going into the debate of the significance of plasma therapy, but when it comes to the mandating of the judgment with respect to the Coverage test, the clinicians had a better idea that, okay, with respect to the titers what they have, should they proceed on with the future treatment plan, including plasma therapy or not. Now, if I just give an apple-to-apple comparison between both the ELISA products, you have a detecting molecule in total antibody with all the immunoglobulins present, specifically with IgM, IgG with respect to the coronavirus infection, as well as IgA, which is obviously a potent marker for respiratory infections. For IgG Coverage ELISA, you have IgG alone, which can be detected with respect to the various titers. Now, obviously, the detection limit is that it is ideal in case of total antibody for early detection. This will be only valid for new infections, so it can detect the onset of the production of antibodies. Nevertheless, a new infection, or so to as to say very specifically, the active cases can be detected over here. Whereas for Coverage ELISA, it will be ideal only for symptomatic patients or with a patient who is having a late detection, who has not been screened properly in the earlier stages, or should I say, who has got mimicking the symptoms with respect to influenza or any other respiratory ailments. Now, the very important part is the patient's data. So as I have said before, with respect to total antibody ELISA, it will be very significant in high-risk zones, the containment zones. Now, obviously, people over here would say that, sir, today as of now in India, we do not have containment zones. So thank God we do not have, and the number of containment zones are coming down. I just want to highlight the audience and the speakers over here. Just now today, the news has flashed out that Mr. Johnson, the PM of UK, has announced that second peak and what you can say prevalence of COVID has already started in Europe, and he's pondering on the what you can say bringing the lockdown again as early as next week. So God forbid it should not come to India, but we do not know how it happens. But if it comes at all, we are much more prepared than before. And this is exactly where this particular total antibody ELISA should play a very vital role, because whosoever is getting infected, and should at all there should be a community transmission, the new cases can be detected over here. And obviously, you do have coverage ELISA. So all the people who are actually now infected and who are getting the treatment can obviously get, what you can say, treated by IgG ELISA. Now, as I have mentioned before, with respect to cross-reactivity, there is no cross-reactivity with coronavirus infections which are already on the panel. And the main important part is the correlation with higher platforms. Yes, both the kits, whether it is total antibody or coverage ELISA, has no interference with coronavirus, and obviously they are very much sensitive to PCR results also. So at par, you can see that both the molecular platform, which has been confirmed as the confirmatory test, we are actually developing a product which has already in the process. So it can screen out with various, what you can say, pedigree, and both with new infections as well as with the patients who are having fading immunity can be treated out. Now, just I have mentioned before, with respect to the various platforms which are available for COVID testing, it should be noted that all other testing is actually only for serosurveillance. Now, this is probably the irony also and the beauty of COVID testing, that other than molecular techniques, no other test has been actually approved as diagnostic tool. Obviously, you can have walk-in patients, you can have randomized patients, you can have patients who are coming for, let's say, community tracing or contact tracing. But when it comes to exactly pinpoint from a mass, and you have to, what you can say, chip in at the very first level with asymptomatic characters, COVID ELISA features the best over there. The reason is that it can be performed in a very small setup. You do not need a heavy infrastructure behind you. Okay, and it is easy to use also. So it's a cheap and a very simple laboratory technique, and the turnaround time of the results is within 3 hours. So you get it very easily for all the population. And the best part of it is that it is approved by ICMR. It has been mandated for serosurveillance and seroprevalence. And also the best part of it is there is no cross-reactivity with any other coronavirus infection. As a matter of fact, the major challenge what we had during the evolution of this product was it should not have mimicking protein panels with respect to other coronavirus like SARS or MERS per se. So a protein panel which is very much identical to what SARS coronavirus infection is there prevalent, especially the type 2 like COVID, should be identical to Indian population also and should cater to the need of it. It should be able to detect it very specifically and exactly at the infection stage what we are hitting in. And the best part of it is that it helps to ascertain how long the transmission has been ongoing. So you can, what you can say, maintain the gradient of the infection. You can actually tap into that particular flow of the infection. So, as you all know now, Gemitra is a established name. So we have been there since 1969 in this industry, and we were known for our mostly for the reagents. So the company was pioneer in bringing the rapid cards for HIV, HPV, and HCV, and also in the ELISA formats. And it was the very first company to introduce the differential detection of HIV-1 and HIV-2 in a single rapid card format, which is the flow-through technology. So the customer success and the commitment to quality has been our pivotal part of our mantra. And we have produced world-class products, be it in vector-borne diseases or the infectious range. And the journey has been very much challenging as well as a success-oriented, just because of the quality of products what we have provided to the customers. And the success is in form of the HIV Tridot what we have in the market, and also the dengue day 1 test. Now, having said that, the company has now forayed into fluorescent immunoassay technology also, and we have got in collaboration with HTIC, IIT Madras now, and we have developed our own FIA analyzer called the iQuant analyzer. And now, obviously, evaluation is definitely pivotal when it comes to developing a new product, and it's equally time consuming. But yes, it has brought in what you can say, the core essence of it, the need of the hour, and it has catered to the need of the customer also. So a batch-to-batch reproducibility is also a strong pillar when it comes to the product development, and we have been constantly maintaining it. Not only that, apart from developing all these products, the company has been conscious about getting validated and acquainted with the latest industry practices, and it has been certified by ISO and WHO also. And we are very much proud to say that, with respect to the philosophy given by our Honorable Prime Minister of Atmanirbhar Bharat, we can proudly say that, as far as the Make in India initiative is concerned, so the company is fully responsible to it, and we have been developing all the products and getting it tested also. We do have a state-of-the-art R&D facility, and the credit goes to the R&D team, which has got more than 55 patents to its credit now. So apart from all the rich legacy which we have carried forward for the 50 odd years, now we have a huge patent list to prove our mettle in the market. So we do have our rapid range, which has 20 odd products, which has been stratified into infectious range, vector borne, and we do also have our first celiac card in the country, and we do have our Western blot also. In ELISA range, we do have 23 different pedigree. So we do have malaria range, we do have the dengue range, and we are probably the only country in the market where we have got HIV ELISA in 3 different formats, be it in the second, third, and fourth generation. So we are catering to the different needs of the people over here. Now, coming to the Quanti range, which is the fluorescent immunoassay range, we do have 10 different products, which ranges from thyroid panel to HB1C, vitamin D, PCT, and the dengue range, and CRP. And we do have our anti-sera and blood grouping range. So constantly we have been evolving into various pedigrees. As I have said, that Jemitra has been a standard name with respect to reagent business, but nevertheless now we have fallen into instruments also, as I have mentioned, for iQuant. So that is the product which we have developed in collaboration with IIT. So it's a, what you can say, easy to use and a high throughput machine, and the results are highly reproducible, and it has a very good turnaround time. So similarly, we do have our ER180, which is the ELISA reader. The best part of it is that it has got its in-house developed software. So if we talk about Atmanirbhar Bharat, we are not only developing the reagents, not only the hardware also, but also the software, which is getting produced from our premises. The same is applicable to our ELISA washer also. Now, the best part of it is that normally the washers, you would see that it is only catering to one particular assay at a time. But the beauty of this particular product is that it can cater to 3 different pedigree. So, for example, if you have an infectious range or a vector borne and a hormone also, you can run all 3 together. So it caters to a high throughput, and the turnaround time can be adjusted as with respect to the protocol of the kit itself. So these are the various products what we have at Jemitra, and we are constantly rising up to the challenges as we have done in the COVID pandemic. So I hope that India should not face the second wave of COVID, as the apprehension is there. And as usual, I think everybody should stay safe and stay calm and rise up to the challenges. Over to you.
Thanks a lot, Dr. Sharbanu. Yeah, we don't want the second wave of COVID. We really no one wants it. So let's go into the panel now. Thanks for the industry presentation. I'll just introduce the panel. We have a very rounded panel here to discuss about the leveraging innovations in diagnostics. I welcome Mr. Jatin Majan, MD, J Mitra and Co. And welcome, sir. And Mr. Dinesh Chauhan, Chief Executive Officer, Co Diagnostics. Welcome, sir. Dr. Ajay Fatke, Head SRL Avinash Fatke Labs. Mr. Dr. Ajay Fatke will be the moderator of the session, and I welcome Dr. Ravi Gaur, Director and Chair, Medical Advisory Committee, Onquist Laboratories, and Dr. Sanjeev Vashishta, Managing Director and CEO, Pathkind Diagnostics Private Limited. Over to you, Dr. Ajay Fatke. Please carry on with the panel discussion. Hope for a very nice and interactive session.
Sure.
Thank you, Pratibha, and thank you, Elets, for inviting me to be the moderator. First of all, I'd like to say that the presentation was quite enlightening, and very happy to see an Indian company with 55 patents to its name. So
Thank
I'm
you,
going to
Dr.
just
Ajay.
so I'm just going to start off with Mr. Mahajan, about because he's the one from the industry perspective. So the thing that struck out to be most in the presentation was the fact that since 1965, you all have been the first to introduce the rapid card test, which I think has been used by a lot of labs in the country, and the fact that you all have had 55 patents to your name. So how do you ensure that innovation is an ongoing process in your organization, and how do you go about ensuring R&D facilities in India, and what is your focus area, Mr. Mahajan? Um, I think you're on mute, Mr. Mahajan.
Yeah, thank you for informing me. And Dr. Farke, thank you very much for your kind words of introduction. Yeah, Jmitra is one of the oldest diagnostic companies in India. We are a 50-year-old company in the field of medical diagnostics. We are a R&D led and R&D driven company. So coming to your question, so basically, when we look at innovation also, we look at basically the customer requirements. And when we look at customer requirements, what we basically are saying here is that we have a deep engagement with our customers to understand what is working with our products and what is not working with our products. So what is working, it's already taken care of. And when we say what is not working, we capture those particular traits of what is not working. And then what we do is basically we share this feedback with our R&D team, because it's important for us to incorporate whatever things which are not working into the product design. And that's where the role of R&D happens. And generally what happens is, as you have heard also Dr. Shadbanu informing that we are always in the business of raising a bar. We are not satisfied with at one level. So we always want to raise the bar and go to the next level. So R&D team is always engaged with our field staff, with getting feedbacks from our technical team also, to understand how we can do, how we can find solutions which can better serve our end customers. Now, having said that, so at the design stage itself, we are able to capture those requirements, what is not working, and then we move forward and actually incorporate those elements into the product, so that once the customer starts using those products, it provides peace of mind while using those products. So basically, this is what basically we generally do. Another example that I would like to share here is the example Dr. Sharman talked about, the iQuant. Now, it's a beautiful, outcome of a partnership that we have had between the industry and the academia. So it's between HTIC, which is the research arm of IIT Madras, and us. Now, this product is innovative in the sense because in one single platform we can do multiple tests. Now, if you look at the conventional practice, we have one machine for hormones, one machine for infectious disease, one machine for cardiac markers, and likewise. Now, here we are doing away with all that, and on one platform we are introducing multiple products. So what it does is it provides ease of use.
Right. Right.
It provides affordability also. So, Dr. Farke, I also saw your interview on ET Health World, which talked about miniaturization of instruments.
Right.
It was a very good interview that you talked about miniaturization, and you talked about tier 2, tier 3, tier 4, tier 5 cities also. Now,
Right.
with this product and this solution, we can install these machines at various taluks and districts across these tier cities. And instead of sending the sample, so conventionally the patient had to come from their hometowns to the main cities or the metros to get their test done. Now, at the comfort of their own places, they can get the results with a reduced turnaround times. With this
Right.
product, so with this product also, what is happening is it can store data, which
Yeah.
is a humongous amount of data. So it can store more than 1 lakh data. Plus, it is integrated with the cloud system. So, for
Okay.
example, if for example, if the data is fully packed in the system, you can take a backup. Just like, for example, in the iPhone, you can take a backup on the
Right.
cloud. So here also the same solution is available, and you
Okay.
can integrate the LIS, even for metro cities where the volumes are less for certain parameters. You can have those tests run on this machine because they got a very fast turnaround time.
Yes.
Secondly, with labs which have got LIMS system, we can easily integrate it with their LIMS systems.
Okay.
Also, uh, the other thing is that in terms of reporting, all those things, it can be easily integrated to the requirements of the customers.
Okay. Yeah.
Another advantage that we have here is that unlike the other machines, here we can do remote monitoring of the machine. So through the internet connectivity, we can diagnose what is working, what is not working,
Okay.
and we can fix up the machine also. So that is the state of the art technology, and that is the innovation we have brought about in this machine. So instead
Yeah.
of physically going to the lab and getting it fixed, we can remotely diagnose and understand what is working and what is not working.
Okay.
Also, over a period of time, what is important here is we don't have to upgrade the hardware part. We have to just upgrade the software part.
Okay.
So just like in a phone, we upgrade the software through patches. Here also, whenever a new product is launched, we just need to update through the patches, which is like in any phone. We just sync it with the internet, and it can, whenever it is there are no tests done during the downtime, it can automatically integrate with the
Okay.
latest modules. So
Right.
this is the innovation that we have brought about in the diagnostic
Yeah.
platform and in the diagnostic industry, and
Thank.
we.
Yeah.
So this is what to answer your question. This is
Yes.
what
Yes.
we
Yes.
are doing in the
Yeah,
diagnostic.
that's a very good overview of how you have used innovations in your, especially from the manufacturer's point of view. And I think such instruments which will be required to take the lab away from maybe centralization in the long run. So one more last question I have for you is that you've been through a long journey in the last 50 years. What are the major hurdles that you have faced, which you would like to highlight, and how have you overcome them? If you could give us a quick word on that.
Yes, thank you, Dr. Karke. It's a very interesting question. In fact, the first thing was, this industry was not recognized. So it's in last 2018 that we have got a new guideline from the regulators, which is a very good thing. It's a good space to be in nowadays. Because the other thing I would like to highlight is that, the spotlight is on the diagnostic industry because of the COVID pandemic. Now, having said that, the challenges I like to talk about is basically the industry academia interface. Now, in international markets, what we see is the industry academia interface. It's very fast. So, if you want to have a product, a solution for a product, a disease, you can get it done within 1 month's time. But in India, that interface is lacking. So, it may take a couple of months before we actually come out with the product. So that
Okay.
is so the launch of the market is going to be delayed, and ultimately customers will not benefit from the solution that the company would like to offer.
Right.
The
Fast. Yeah.
other thing is the other thing is the QC sample and the samples which are required for the R&D. Now it's very
Right.
important in the pandemic scenario. The main challenge with the industry which faced is getting the QC samples so that we can fine tune the quality of this
Right.
product. So
Right.
the other thing is, to fine tune the quality, because ultimately in diagnostics, what is important is quality, quality, and quality. And
Right.
to get the good quality, we need to have those panels also, so that we can give the best and the highest quality product to our end customers, so that they can experience peace of mind. So
Yes.
these are some of the challenges which the industry manufacturers face. Thank
Okay.
you.
Okay. Thank you very much for that. I would
Thank you.
like to now call upon Mr. Vashisht to for the next question. Now, you have seen the industry from all sorts of angles. You have been in the hospital side of things. You have been head of the chain before, and now you have taken over Pathkind. So, in your experience, how do you see technology playing a role going forward, and how is it changing the landscape of the diagnostic industry? If you could tell us in brief, please. You're on mute, Mr. Yeah, sorry.
Oh,
Yeah. No, yeah.
yeah. Okay. Am I
Yes,
audible
yes.
now? Yeah. So I think you are absolutely right. I think a lot has changed during the last couple of decades, if we see, and especially so over the last 5, 7 years, when we have witnessed, IT and the techies taking over the
Right.
domain which was purely in the hands of pathologists, right? Now, when we talk about innovation, what we are essentially looking at, we're looking at five things. One is how can we hasten the process? How can we really, reduce our turnaround time? Second is how do
Right.
we increase the accuracy, reproducibility? The first time and every time you're conducting the test, I think that is there. Thirdly, we talk about
Right.
affordability at the hands of the end customer. Are we bringing down the prices so that these become
Right.
affordable at the hands of the customers? Then we talk about scalability, because why POCTs have not really overtaken the conventional market is because
Correct.
of lack of scalability. While at one level we talk about POCTs to be placed in the remote location where the masses are, where you need to do large
Yes.
scale scanning or screening. Yet, these POCT, the technologies or the machines, they lack the scalability. And lastly, it
Correct.
is the mobility or the accessibility. So these are the five
Right.
areas where the innovation has to play a big role. Now, what we have seen over the last few decades, if you see, look, if you have to divide the functioning of diagnostics into three segments, one is pre-analytical, analytical, and post-analytical, you see what kind of changes or the
Hmm.
innovative things that have happened over the last few years. Let's come to pre-analytical first. uh, we used to have this network. We used to see that companies, they started creating a network. We used to have one lab, then from one lab they created multiple labs, and then
Right.
collection centers, the
Right.
bleeding stations from where the samples used to come in. Now, the collection centers typically used to carry the samples and the TRF, the test request forms, to the closest lab from where the accessioning used to be done. Now, we are always at a risk of the sample getting mixed up. We are always at a risk of the integrity of the
Right.
samples to be lost for multiple reasons. Now, what we did was that, using technology, we put the barcode at the
Correct.
point of collection of sample, be it home collection or be it the samples being collected
Yes.
at the collection center. Now, the case is, I have to cite one example to you. It has worked wonderfully for
Hmm.
us during this pandemic, because the government, they were sending the samples from left, right, center, from all the places, every nook and corner, and they wanted the result almost
Right.
instantaneously. Now, what we used to do was do the barcoding at ground zero. By the time the sample would hit the lab, by that time the registration used to
Already
already
done.
used to happen,
Right.
right?
Right.
So that is one thing. Second is that the logistics has played a big role. Now the riders who are actually garnering the samples from every place actually in the country, tier two, tier three towns, even the villages, now they can be tracked by GPS. We have seen, that we create a kind of a structure around the mobility of these riders. So if they are moving from location A to B, you can track them on route. You can also, through RFID, check whether they have reached the requisite destination or not.
Right.
Another thing is that you're using the temperature loggers, and
Yeah.
we have this app which we are kind of using, which is using the IoT, Internet of Things. We are able to see whether the temperature at any point in time was out of sync.
Fluctuated. Right.
So, yeah, and then you are able to maintain the integrity of the sample. Similarly, now what we've seen is that at the back end we have ERP, robust ERP in the front on the front end. We have the limbs. You are able to integrate both these thing aspects to ensure
Yeah.
that the pre-analytical thing is taken care of.
Okay.
Coming to the analytical part, I mean, we have seen what kind of changes that have happened. If I
Hmm.
pick, obviously there are multiple subsegments within pathology. If you look at, serology, for instance, from rapid cards to ELISA, now we're
Hmm.
talking about, CLIA. We are also looking at LCMS, GCMS, etc., etc. Similarly, on cytogenetics, the kind of innovation that we have seen is really mind-boggling. Karyotyping, which used to done now, microarrays and all, which is
Right.
giving you far better clarity of the chromosomes. And again, that's nothing but innovation. Molecular biology, from PCRs to RT-PCRs to Sanger sequencers, now NGS, I think everybody
Yeah.
knows. So Histopathology again, you used to do tissue processing manually, and now you are using tissue processors. You're using microtomes to cut the tissues in a very fine size. So all I'm saying is that on the analytical side, so much has changed from the initial days, that pathologists have now adequate resources, adequate help support to really ensure that what they're giving is really top notch in terms of accuracy, in terms
Absolutely.
of reduced term, and then the added advantage of telepathology, and the technology is getting more and more non-invasive. You need not
Right.
really cut the patient to get something. I think now you've got the scanners and multiple other things which can really tell you as to how best you are able to
Right.
when you're reading the body of the person, you're able to do justice to it.
Absolutely.
Similarly, lastly on the if you talk about the post-analytical side, the reports are not available at the click of the button.
Hmm.
Patients, they need not really go to the lab, or lab need not be sent person with the hard copies of the report. You can click it. You've got multiple facilities in the form of WhatsApp, or even small things which have happened. So what I feel is the use of IT and telecom has changed this world. And the good thing is that at in the space of diagnosis or diagnostics, we are using the technology to the hilt.
Right.
Long way to go. Yet, I think what we have achieved this far, I think is commendable.
Yeah, thank you for that very comprehensive overview of the industry. And I think, as you rightly said, there has been an effect on almost every aspect of the diagnostic sector in the last decade, especially in the last 5 years, with the advent of every change possible. And it has all been enabled by technology and IT, and it will only continue to get more and more exciting. Now, since you mentioned next gen sequencing, I would like to go on to Dr. Gaur. Now, in your experience, Dr. Gaur, we are seeing a lot of interest in and a lot of buzz about big data analysis, next gen sequencing. We are hearing lots of things about preventive oncology, liquid biopsies. In your opinion, which is the technology which is going to make a huge difference in the oncology space, especially in a country like India, where cervical cancer, breast cancer, head and neck cancer is on the rise?
Uh, Thank you, Ajay, for throwing away a very relevant question, because I have come from the background of Onquist, which is probably we were the first one, probably one of the first one to enter into the oncology, molecular oncology, and sequencing phase. But before I answer that question, I like to say something what Sanjeev has spoken, and what we heard from J Mitra team, or Dr. Ghosh and Jatin. Like the very important topic today, you is like leveraging innovations in diagnostic. I wish we could have added here is leveraging affordable innovation. I think that is something, because there is a lot of innovation happening all across. The technology is evolving very fast, and it's growing at very fast pace. But by that whether it's affordable to the masses or to the Indian
Right.
population, and that's a very big question mark today. So we need to have affordable innovation which needs to be flexible to the need of India, and because we have a very diverse country, and we which can do more with the less. That means more information has to come from this thing, and make the process simplified. And that's where I think the country like India, we are resource constrained, but we need to address all the healthcare delivery challenges. Ultimately, I think it's important that it's available to everybody, accessible to every citizen. So affordability is the key to accessibility, and that's where I think innovation has to be affordable. And if it is affordable, then only you can sustain it. Otherwise, you keep doing innovation, and probably you will never be able to reach the critical utility. Now, what is I think for this, what we really need is here. I think we have people from all industry here. I think maybe the audience also out there. We need to have a right kind of support from the government. There has to be some fiscal incentives. There has to be a policy support. What Jatin was mentioning, like regulatory and faster kind of technology approvals and financing mechanism. There has to be human capital and best in class infrastructure availability and of course the linkage between academical people
Right.
and the industry people. Because this typically, you can see the success of this was into COVID here in India, because the way the government, diagnostic people, devices, kit manufacturer, the private industry, and the delivery people, rather all the regulatory authorities, the way they initially they were a little chaotic in initial 1 or 2 months. After that, they formed a group, and this is where we, from almost 100 labs to 2,000 labs of between COVID, RT-PCR, which has never happened in the world, and made it affordable to the public and the masses. Samples were picked up right, left, and center, and testing across by all the major labs, including yours, Sanjeev, and I think everybody is out there. We doing similar things. That is, I think, the need of the hour today, and that only you can make any innovation successful. The second, the issue here is, of course, we need to. There is always an urgent need to have something called translation research. You know, the
Right.
whatever we are learning in the R&D factories, R&D center, it has, and because now this country is burdened with the all NCDs, diabetes, cancer, cardiovascular, and multiple plethora of infectious diseases now coming back to the focus, which is probably has gone out of focus. We never thought people will die of an infection now, but now this is something which is so NCD with I probably can have look into it, infectious disease, and this is where a quick translation, both of the what is happening inside the R&D, it has to come back to the clinical utility, and nothing like in place like India, where we have a favorable demographics, availability of resources, economical rates. We can enabling technologies like internet, mobile, social media, clouds, big data. There's a fertile basis for innovation. And probably before I close this my topic, our country requires today startups. There are many startups that come. New generation thinking people. We talk about next gen sequencing. I'll say next generation who are thinking differently, which is a local thinking. It has to be not like a global thinking, because we are too diverse and our problems are too diverse. But it cannot be only local thinking, a local thinking which have the potential to make enormous global impact. I think
Right.
that's where I think we are going to be, and that is where we should be.
Okay.
So now, the innovation probably has to be not really incremental, two kind of thing. What we broadly incremental innovation and a disruptive innovation. Today we need definitely a disruptive innovation. Like incremental could be like you have a diesel car and you improve upon the average. You done something, okay, giving me a 16, now it's 18. That's okay, it's good part, why not? But be a disruptive. Now, what is disruptive? What I mean is, like, can I, when we are doing the say blood sample by sugar, or the hormone sample by the hormone testing by the blood. But can we, and that's a logistic challenge, picking up the sample, transporting it, bringing it to the lab, all pre-analytical. Now, can
Right.
we address it by doing something in sputum? Can we address it by doing something in saliva? Can we do all the thing in the urine, where the sample can be collected by the individual, put it into a box, sealed it, and shipped it via FedEx or Blue Dart to the labs? All
Right.
these issues to be sorted out. I think these technologies are available, LCMS and multiple
Right.
information things. I think we need to bring that in. And I don't foresee a challenge probably here, but I think there'll be a cost involved. But future
Right.
is for that. So I think
Okay.
that is disruptive innovation what we need to address here, because which will not only help the address the point of care testing, but the skill guys. You don't require skill for something. You just have to spit and mucus, which is like I've seen a lollipop technology of saliva, where somebody just chews something like a lollipop, because normal spit and mucus is a challenge. They spit on the chew the lollipop, and actual saliva comes out at that point of time. They put
Right.
it into a container and ship it, and by 48 hours, 72 watts at the ambient temperature. India has a
Right.
two diverse temperatures, not like European countries, temperature never goes beyond 30 degrees. Here it is almost like 40, 35, 40 at most of the time.
Right.
Sample doesn't get spoiled. And of course, the dry blots, the filter paper, all these technologies, I think we need to take care. And the newer platforms you're developing will be more information, like LCMS and spectrometry. I think that's going to be taking on.
Okay. Okay.
That's first part. Now, second, you talked about the oncology and NGS. Yes, I think it is NGS. I will really probably focus more on NGS, because this is the in thing today. Uh, as the genomics is now getting, a greater role in the cancer treatment, NGS is actually evolving day by day. And of course, is valuable methodology to find a deeper and more accurate into the molecular underpinnings of the individual tumors. We're doing tumor profilings, and we're giving various so many of mutations we are studying. And now the therapies are becoming targeted therapies. This is a new standard of care. You have to have a tumor profile. You have to have a drug which works on specific mutation. And now you're seeing the chemotherapy the way they are. They're like an OPD procedure. People are giving chemotherapy at home. NGS has enabled that, and it has evolved last 7-8 years very, very well. Because using the information what we're getting, analytical information what we're getting, which is combined with the AI and of course the various algorithm data. The more data we're getting, better we are becoming day by day. Now, compared to the traditional methods, why NGS is better? I think NGS offers advantages in accuracy. It's becoming the day by day is better. The initial NGS at one point of time, genomic sequencing was taking many months, but today it's almost like 48 hours. You can do that. We have instrument become smaller and smaller. Can be a desktop system. Probably people are talking about now handheld devices. We can do some small 50 or 80 or 120 genes kind of profiling, which can be done on the spot in 2 hours, 6 hours. Now, this is what the talk is on. It's an advantage is this accuracy, sensitivity, and speed. That is most important, and it's working very well in the field of oncology today. And I think none of the oncology tumor cancers are now going without sequencing, and this is going to be future. Not only oncology, I foresee probably lifestyle disorders, whether it's a cardiology, whether it's diabetes, because it could be a personalized health check for that wellness segment, or it could be infectious diseases now, because now people are getting more into molecular microbiology. COVID has shown us how many, not only this virus, what is the, because you can see multiple strains of COVID coming up. It could be COVID-19 virus or some other strains and mutants out there. I think NGS is definitely going to be the one.
Okay, thank you very much, Dr. Gaur. I think you touched upon a lot of important points in where innovation is actually going to play a big role, whether it's in the oncology space or overall as a sector. The diagnostic industry will have to have some disruption for it to actually go to the next level. Mr. Chauhan, I think core diagnostics has been a very critical player in this field, again in the field of oncology, but of course in other areas as well. What we see a lot of in the West, where in places like MD Anderson or anywhere, say in Phoenix, they are very quick at adapting new technologies. Right when Theranos had come into the picture, the first state was which started off was probably Phoenix, and they have started actually using it in Walgreens and things like that. When we come to India, like Dr. Gaur said, price and affordability is a very, very crucial factor. So in the oncology space, in spite of having a huge disease burden of in all kinds of various oncology areas, how do you see it playing out in the next few years? And are these tests actually affordable and accessible to a vast majority of our population? And if not, how do you plan on using innovation to get them to access these tests in a larger scheme of things?
Thank you, Dr. Ajay. And I would definitely like to share in detail about this. I don't know how much time I have.
You have time. You have about 5 to 8 minutes. Yeah.
Okay. And Dr. Ajay, Dr. Gaur and Mr. Vasist has touched so many important things of diagnostic industry. But if I talk about that, how innovation has evolved and affordability, it has evolved huge. If you talk about 10 years back, the test which is now available for CML was 12,000 rupees. Now it is available at 5,000 rupees. And it is going to, further, it is going to be more affordable as soon as the awareness will increase. And technology, actually technology adoption is also one of the challenges in our country. And why I'm saying so, see, Dr. Sarbhanu has said very important thing, that what have we learned in this pandemic situation? It is like how fast we learn the technology in the crisis.
Right.
Telemedicine was there in so many years. Since decade, telemedicine was there. But we adopted this in last 3 months of time maximum. Online prescriptions are there. So when these innovations, these technologies are adopted well on time, then you definitely reach everywhere. And when you reach all the places, you get majority of the volume of the samples, and then affordability automatically goes. Affordability becomes affordable for the patients actually. So that is where the technology plays an important role. And the third point, which I have you said, that reach to all the places for the all rare test or important test for especially for oncology, in fact for all diseases, that is also going to happen because of technology.
Right.
Like digital pathology has plays a very important role in this, but see the adoption has become so slow. In fact, I remember one said recently, the Francis Collin, the director of NIH, he has said that we are going to use after 15 years what is available today. And why
Right.
is it so? That adoption, see, digital pathology core is using since beginning two-way digital pathology. If one pathologist is sitting at task end, they just scan the slide, send it to us, and we give the report from here. That
Right.
is what we have learned in now pandemic. Yes, it is possible. The two-way why I'm saying is, in fact, from here also we have organ experts in Europe. We just scan the slide and take their opinion, which
Hmm.
reduces the time, which reduces the cost, and the reachability as well.
Right. Right. Right.
Same way, the next thing, if I connect with the digital pathology, is our data. See, in India, for data, we were so scared about sharing the data and know that something can happen. But
Hmm.
now data has become so important. See the banking industry, they have made the data live. The banking industry has become boom. Like anything you can access any point of time. You have money in your hand, always plastic money. Same is that data is going to play a very important role in the science. Digital
Right.
pathology data. If
Right.
we have, and in healthcare industry, almost every patient in a year generate approximately 100 terabytes of data. And if we are saying that data is not structured in healthcare industry, no, it is a myth. It is structured. Only the problem is, the challenge is, it is not very well correlated
Right.
clinically.
Right.
And if that data is very well correlated, unified, which some part has evolved,
Hmm.
like Mr. Vasishtha said, that things has evolved a lot. So yes, with that perspective, if we can correlate the data clinically well,
Hmm.
then the next step will come in. What is going to be the evolution for the industry, which
Hmm.
will definitely reduce the cost, and which will definitely reach all the places. That is artificial intelligence.
Hmm.
Dr. Gore said just now that NGS is going to play an important role if we have artificial intelligence.
Hmm.
And if you link all these 3 points, artificial intelligence is going to be successful when data is there,
Right.
when
Right. Right.
digital pathology is there, and if it is very well correlated, and in fact integrated pathology is going to play an important role for technology, like radiology lab and radiology report and pathology report. If they are integrated, you give a lot of information to the patient at a affordable cost.
Okay. Okay. Yeah.
In fact, clinicians cost the treatment cost also goes down.
Hmm.
So
Hmm.
one example I want to give. See, one example. There's a company Ibex based out of Israel. They are actually giving prostate cancer reports since last 3 years, and they are highly successful.
Hmm.
Accuracy is almost 96%.
Hmm.
And the advantage of that is you can reach all the remote small cities if
Right.
we have enough technology. And thankful that our Indian government, that now internet is available at all the smaller towns.
Absolutely. Right.
So
So
that is the advantage of, yeah.
so yeah, yeah. So that's a very important thing. And now, like you rightly mentioned about data, that's something which is like almost like a currency nowadays, where people whoever can analyze and mine data the best probably will win out in the long run. So
Yeah.
do you think that we are geared up in terms of data scientists, machine learning, and the entire infrastructure in this country to meet up to that challenge, or are we still not in that position where we are able to use our data effectively? Because just having data at the end of the day will not be enough. What to do with that data and how to utilize that data is something which we will have to see, right?
Surely, I think Dr. Gore want to say something. And
I like to answer this question. Dinesh is very importantly raised, and as Jatin also raised. I think Sanjeev was to all. Of course, everybody knows about the importance of data.
Yeah.
But today, we also know the government is trying to put that national digital health mission, unique health ID to everybody. Government of India.
Yes.
But the basic problem today is the standardization of data,
yes,
because the across you can have all the labs, the government or private, wherever it is, the nomenclature of tests is different. My CBC, your CBC, their CBC, and their CBC is everything. Somebody writes something else, somebody writes something else, somebody will write something else. You can integrate it. Where do you get to it? Probably nothing, because you constantly have to have standardization formats and protocol, because to have a meaningful data, there's a lot of rubbish in the data today. But I think the first protocol where there's total standardization to happen, where this is what it is, and what do you really require for the data to make a scientific meaning out of it.
Right.
Because I think this is actually happening at the individual lab basis, yes, or individual center basis. Maybe your center is already doing, or Sajeev is doing, and I think Ganesh is also doing, and we also doing, and I'm probably same from the other players out here. But make it meaningful. This is, I think, the biggest challenge here. Now, that is now second important. I think I'll just make one more minute before they talk about cost actually. So I feel that we have to compare the apple to apple, because it's not the cost means if you're getting a much more value out of something, and like if you got a rapid testing and you get a infections panel which is tested and all the bacteria, viral, fungal, everything within 12 hours or 6 hours, and septicemia patient, you get all the report in 12 hours. Now, is that better, or somebody is getting first day get a normal blood test, second day you got a culture, third day you're getting the PCR, fourth day you're getting a fungal test, 5 days of ICU admission versus so much of antibiotics, antifungal versus 1 day of admission, one test. I think we always correlate diagnostic as an independency. I think because we give the maximum information, we have to put together all the things together, and then we realize probably the cost is not that much, probably, and the cost is, and the kind of value, you have to have a similar value from our side, that's fine. I think the value you're getting out of it, and what benefit in overall somebody getting healthcare, the costing wise, that works wonderfully well. Like liquid biopsy, if you have people dying from prostate cancer from urine samples, no biopsy is required. Probably 3 urine samples, they take extract cell, circulating tumor cells, cell-free DNA. You don't have to go surgery for the biopsy, CT scan, immediately blood sample. I think this maybe the cost of liquid biopsy is higher, but overall cost will be much, much higher. This is what I want to add on here.
Okay. Yes. And Dr. Ajay, for your, I would like to add a little more about it. Yes, we are not ready right now, but that we should create that mindset. We should, first of all, in fact, before that, first of all, we should create ourselves, or we should create a system that we should not adapt the technology only in crisis. We should adapt the technology as fast as possible. Second thing is for data. Yes, we industry experts are there. We should create a system where data, if we can create a clinically correlated, integrated data, then artificial intelligence will definitely be successful.
I'm from army background. I have to add on here, the war is learned when at peace time, not at the war time. You have to prepare. That's what you exactly have to say that.
And with that, I would like to say a very good saying that, see, there is one more myth, or the pathologists probably they are hesitant to accept this, that will this AI, artificial intelligence, replace the pathologist? No, it's a myth. But it will definitely replace the pathologists who are not using this AI. After some time.
It will be an aid to pathologists rather than replacement, right?
That's what AI should be, augmented intelligence, not really artificial intelligence. It's adding to us.
And Dr. Gore added very good point. The augmented reality has become now the next thing. In fact, AI plus AR is going to play again, where 2 pathologists sitting across the borders and they are seeing the same slide. That is called augmented reality, and people have started using it. And surprisingly, that though we are using this fish-based technology, BioView, since the beginning of 8 years, but now that augmented reality has become for histopathology as well, which will definitely bring great quality in this actually.
Rajay is a word of cautious here on this thing, because we, all the technologies are giving a lot of analytical information. We need to have analytical validity first before we can have clinical validity, and we need to have clinical validity before we have clinical utility. I think that's a point I think we should be taking care of.
Absolutely.
Thank you. I would like to move on to Mr. Vashisht again. I think we have seen in many industries now, everybody's talking about 5G technology. Tesla has sent multiple satellites which are going to provide internet connection across the globe, especially in India. Now, I wanted to ask you, what do you feel are the major threats which are currently going to face the diagnostic industry? For example, some of these aggregators which have come up and raised a lot of money in the industry, do you feel that these are major threats, and how do you think the industry should be tackling them?
So, Ajay, very, very interesting question, actually. See, the point is that as far as somebody is able to add some value to the whole scheme of things, it's fine. Now, I have seen, while aggregation is a good thing, I think as long as they are able to create consumerism and they're able to attract the consumer by making the things affordable without compromising on the quality is fine.
Right.
Now, unfortunately, what we are witnessing is that that quality thing is missed out. And what actually, as an aggregator, if I'm hosting number of service providers on my website and only comparing them with on the price points, then probably is not the right thing to do. So
Right.
somewhere I think we have fallen into the trap of valuation as opposed to creating real value. Now there's a sea of a difference between the two. So I think ideally we should try and see what value we are able to create and our valuation would follow. But
Right.
if our site is only on the word valuation, perhaps we are missing out on value creation.
Right.
Now there are multiple challenges in this. One is that you know uh, are the people able to get the right kind of quality? No, I'm not too certain if you are picking a sample from, let's say, a Timbuktu or let's say Asansol and ferrying it all the way to Mumbai or to, let's say, picking a sample from Tiruchirappalli and getting it to Delhi under the extreme heat conditions that maintain the integrity without, using the right kind of packaging material or dry ice and stuff like that, right?
Right.
So
Right.
if you're trying to play only on the price points, there's a problem.
Right.
So that is one of the challenges which we see. Quality is taking a back seat. The good thing is that now with this pandemic, especially, what has come to the fore is that pathology has not remained merely as a back end function. I think we are dealing with a disease where we don't have a solution, we don't have a treatment, but what we have is diagnostics. If you are diagnosed, you can isolate, you can quarantine yourself, and that's the best you can do. So people have now probably, I'm hoping that they'll realize that diagnostics plays a very, very vital role. So let's not just shove it under the carpet. Okay, whatever somebody has told me is go there. So people will now be discern. They'll become discerning enough to go to a lab which is offering quality, which is giving the right results. Now,
Right.
it's not about taking any report, right, good, bad, ugly, and going to a doctor because basis the report, the doctor is going to prescribe the treatment. If
Right.
the report is wrong or the values are deranged or wrong, I guess you can't give the right treatment. So I mean, challenges are huge. Technology should be used ideally to, as I said, to improve the accuracy and bring affordability. Affordability
Right.
is going to happen. You see, in our country where only 20% of the patients have ever given their blood for testing, probably we'll see a spurt in that. So
Right.
imagine if I have to cite one figure to you, until pre-COVID days, I think the total share of molecular diagnostics testing was somewhere about 12.5% in the overall, IVD pie, right?
Right.
I will not be surprised if in this financial year it goes up to as high as, let's say, 37, 38%. I'll not be surprised. So, which
Yeah.
means what? I mean, people, the more, I mean, they want to do the right thing. They want to, get the right kind of treatment.
Right.
Affordability will happen as more and more people start believing in pathology, as long as they believe that, yes, if the right diagnosis is there, I'll get the right treatment. So
Right.
it should always be, diagnosis should always be preceded by, a treatment. So
Right.
diagnosis has to happen. Good thing is 70% of the clinical decisions are now taken basis the diagnostics or
Diagnostic.
investigative results that are there, right? So
Absolutely. Absolutely.
yeah.
And I
Ajay,
think,
Sanjeev has mentioned about consumerism. I'll just say in the era of consumerism now, definitely consumer wants a lot of things. But I think skill and the quality can never take a backseat because the aggregators can be there in the pre-analytical and post-analytical, that space. And I think what's important here is they will definitely like to talk to the skilled people who are doing the testing and what more value we can get to the information. I think we need
right.
to add on to R, and that's where I think the various new tech, the internet technology or WhatsApp or whatever the data analysis, and we need to work slightly better on that. And that's, I think we will. I don't think aggregators can be hitting into it. I think consumer wants today. Yeah, of course, healthcare industry people are saying going into ICU. Like we are in the patient, we have to go back to the customers. Probably they require doorstep, and we are ready for that. And probably I think skill and strength and quality, that is going to matter, and that's where sooner or later they will understand we are more important than the aggregators.
So
one short point today, I think you asked about this 5G thing and all. I think that's one aspect which is going to actually strengthen the whole thing. See, we are present in tier 3, tier 2 towns with the labs, not just the collection center. Now, in some cities, we feel that while internet has really penetrated very nicely in our country, yet the speed is not there at times, and that's the reason why you are not able to host everything on the cloud. Ideally, I would like to have my server on the cloud only without building any redundancy in the form of having physical servers. But now I have to double the cost. I have to have a hybrid model. So in those small locations, I have to have that a small server so that the data doesn't get lost, or I'm able to work offline also as soon as I get the connectivity. So I think this 5G thing, etc., are going to, I feel, augment the speed and everything, and we'll be able to, remain connected 24/7, all through the year. So that's one aspect. I think now it's emerging, and this is a good sign.
Right. I would like to also add, like you said about these aggregators, that right now they are front end facing, and they are the ones who are taking the bookings. And like Mr. Vashish said, they are tied up with all the possible labs. But soon, many of them will be moving from aggregators to actually having their own labs in house. And that is when I think a lot of changes might come across in the industry, because they will now be the front end as well as the back end, from what people are actually saying. But as long as I think we maintain quality, and like Mr. Vashish said, we have add value, I think the industry should be okay. Now we have about 10 minutes, I think 8 minutes to go. So I would like a couple of questions, one to Mr. Chauhan and one to Mr. Mahajan. So before we wind up, so Mr. Chauhan, is there, I really want to touch upon this whole aspect of two things actually. When we talk about data analysis, we have 23andMe in the United States, and we have a lot of preventive oncology, so to speak, or rather early detection of cancers with liquid biopsies. What is the status of this today in India, especially about liquid biopsies, and are they being widely used? And do you see that changing over the next 5 years?
So for liquid biopsies, first of all, this is right now for not available preventive.
Yes.
To be very frank, especially in oncology.
Yeah.
But yes, for diagnosis, treatment regime, it is available. Right. And in last 3 to 4 years, it has been effectively started using. Okay. And this has come only when the technology awareness has come. This is started from one place. If you talk about NIPT, which is not an oncologist though, but that was the first place from where this awareness has come. That via blood also, simple blood also, that there is a circulating cells in the body where this can be. And then in oncology, it has played a very important role, especially in lung cancer cases when getting tissue was an issue.
Right.
And or tissue is exhausted in some of the other tests. In that case, liquid biopsy has become very important. And yes, it has started playing a very important role in India, especially a lot of doctors started using, but still affordability is an issue because the liquid biopsy right now is a little expensive.
Okay. So you think that cost will be brought down over a period of time and it will be more widely used?
Yes, diagnostic players have started using it now to bring the cost down. And I'm sure that soon it will be more affordable and people will use it, because in Europe and in US, liquid biopsy has become so important. And I'll give you one example. That is this Guardant product. Guardant is globally using huge liquid biopsy. That's a liquid biopsy test only.
Right.
And and that's and efficacy and accuracy close to 98%. With that 98, 99%. With that perspective, if we talk about in India, we now things are evolving. Indian labs are building up in-house. We have also started in-house liquid biopsy, and clinicians have started using it.
And
There is a product also called Pantam, which is used like from Europe actually.
Right.
This is a screening test preventive oncology. With the blood test, you actually can basically flow cytometry assays and algorithm. Where you can actually take out preventive lot of cancers which can be predicted at very very early stage. And this
Right.
technology is still validated for India in the validation process. But I think it's a good product. I don't foresee that early, but I think sooner or later, probably. But earlier I was thinking about 10 years. Now probably next 5 years, this is going to be a reality for preventive oncology.
Okay,
Yeah.
so
A
that's
lot of developments are happening towards preventive side as well.
and do you think that actually that will be a good way for us to reduce our healthcare burden which is there in the country, since the healthcare expenditure as a percentage of the GDP is so low? Do you feel something like preventive oncology will help us to manage a healthcare burden over the next 5 to 10 years?
Absolutely, that is going to play a very important role. I'll give you one very good example. See the lung cancer cases. If we talk about 6 years back, lung cancer was there, and the volumes has gone heavily up. And if we have, and because of that, the burden has gone up on cancer cases. And if we have something preventive, if
Right.
we have something preventive, we would have. If we would have something preventive, then early stage diagnosis can be identified and treatment can be started.
Right.
So that is why it is going to play a very important role. If we can get some preventive oncology test, will be very helpful. A lot of
No,
developments
not
are.
only early diagnosis, also probably maybe helping out on the early relapse and prognosis and designing the therapy. That will help both ways, definitely.
Okay. Thank you. I have one last question for Mr. Mahajan. I think everybody raised a lot of important points, especially that any company, whether it's in the industry side or in the diagnostic space, it has to react very, very quickly, right? It has to adopt to what is happening at that moment and ensure that its products or services are in line with what is required in that moment. So, Mr. Mahajan, how did you react to this pandemic situation, and how long and what was the process that you had to ensure you could come out into the market with a kit which could be used immediately, because the pandemic started abruptly and you didn't have that much time?
Uh, Dr. Okay, thank you for asking such an interesting question. In fact, as you rightly said, for everyone here in the industry, it was indeed a very, very challenging situation because COVID-19 was a new disease for everyone here. So there was no precedence, there was no standards available. So, it was like, going to the drawing table and working from scratch. Generally, if I give you some perspective, suppose we start working on a product, a diagnostic product. Generally, the time taken to launch a product is at least 2 years, minimum 2 years, because there's a lot of things which need to be worked out in detail in terms of quality, as what every member here, parent member, has mentioned about quality. So quality is of paramount importance, and accuracy, in terms of accuracy, precision, reliability, they're very important. So sometimes what happens is, we have to do a lot of experiments. Sometimes these experiments work, sometimes they don't work. But with passage of time, we need to freeze a specification. So here in COVID-19, there were no such defined specifications, and there were no, as I mentioned in my earlier interaction, we went to the drawing table since there was no previous history available. So we started afresh. We started researching on it. We collected all the data. We spoke to a lot of customers. We went to the drawing table. We made a product, and in spite of challenges in terms of being locked down, so we had a lockdown only for 3 days in the entire spectrum of this pandemic. So only 3 days. So when the lockdown started in March, so we were operational, and that to 3 days we were not operational because we had to get clearances in place. Now, having said that, our R&D team worked day and night to launch this particular product of total COVID-19, all the ELISA, IGG, IgM, and IG8, what Dr. Sharban also talked about. It was indeed very challenging because, even, as I mentioned, QC panel samples were required. But, because of the technicalities involved, So they were not easily obtainable. But the surprising thing this time was the government was very supportive. I got clearances from the government in just 3 days' time. Even when we requested the Department of Biotechnology that we are having this challenge, the
Right.
surprising thing was they went all out and they supported us into the entire process of uh,
Okay.
from ideation to launch, and then getting clearances from the drug regulator and then launching it in the market. Fortunately, we were the first company in the market to launch this product, and with very high quality standards, what Dr. Sharbhanu also mentioned in terms of sensitivity and specificity. And that's how, today we have a lot of acceptance in the
Okay.
market for
Okay.
these
Okay.
high
Thank
quality
you very
products.
much. I think it was a great effort on your part, and even in the lab space, Mr. Vashish, Mr. Chauhan, Dr. Gaur, all of us have been facing tough times. I'd like to, I think, wrap this up because we are out of time now. I think Pratibha has also arrived at the last moment. So, yeah, Pratibha, I think the panelists, and I think you can take it from here. Yeah.
Yeah, thanks a lot for Dr. Ajay. You had carried out the whole session so well. Moderation was really good. Right questions to right people and lot of informations. I actually don't want this session to stop now, but we have time constraints. The next session is
Right,
about to
right.
begin, so we need to wind it up. Thanks a lot for each panelist who had had made time and coming here and sharing your thoughts. It was really nice. We would like to give the speaker certificate as a token of thanks from our side for making it up and coming and participating in the second edition of Healthcare Transformation Summit. I would like to ask my team back end, can you please share the speaker certificate? Thanks a lot, Dr. Sharbanu Ghosh Dasidar, the customer relation of KOLJ Mitra and Co. Private Limited. Thanks a lot for coming in and sharing that wonderful industry presentation. Thank you.
Thank you, Elets, for giving me this opportunity, and thank you for all the panel speakers over here. You have shared a wonderful insight of the challenges and how we are all, as cumulative industry partners, we are rising up to this challenge and addressing to the need of the hour. So I hope that we can constantly strive into that mission, and I wish all of you a best of luck and stay safe and stay calm. That's what we
Thanks a
can pray
lot,
for.
Mr. Jatin
Thank you.
Mahajan, MD of J Mitra and Co, for taking your time and sharing your valuable inputs. Thanks a lot. Now over, Mr. Mahajan.
Yeah, thank you very much, Elets team, for giving me this honor and opportunity to share my views on this platform. Thank you.
Thank you. Dr. Mr. Dinesh Chauhan, CEO of Co-Awareness, thanks a lot, sir, for coming in as well and sharing your thoughts. Thanks.
Thank you for giving this opportunity, speaking with industry experts, and thank you, Jay Mitra, as well. That learned a lot today because of new things, new product about you.
Thank you.
Thank you.
Thanks a lot, Dr. Ajay
Thank you.
Fatke, Head SRL Avinash Fatke Labs. Thanks for being the moderator. I have pestered you a lot with a lot of questions and other
No, no,
things.
that's
Thanks for,
thank you. You're
taking
welcome.
it all out. Thank
My
you.
pleasure.
Yeah. Thanks a lot, Mrs. Sanjeev Ashish, Managing CEO, Pathkind Diagnostic Time.
Thank you very much, ma'am, for having me here, and very, very nice interacting with all the panelists, and good presentation, Jatin and team. Fantastic. Thank you.
Thank you, Pratibha. I think it was, I think, a wonderful introduction, and I think very important to see that we are now devices, manufacturing, delivery, skills, strength, and media and awareness, everybody coming together to deliver. And we must leverage the marvels of science to solve our healthcare problems, especially in diagnostic, which is a great potential ahead. Thank you so much.
Thanks a lot, Dr. Ravi. I would like get back to you all. We will be continuing such editions and summits. So I will again start following up with that. So keep me posted and thanks a lot. Thanks again.